Welcome to Steve Means Business, the podcast dedicated to promoting and highlighting small business all across America. As an entrepreneur who has launched many small businesses in various industries over the years and blessed with the gift of gab, Steve was made for this podcast. Let's do this.
Welcome to Steve Means Business, the podcast that's all about promoting small businesses all across America. Today's episode is something that's going to affect virtually all of us, unfortunately, and that's senior care and healthcare for both ourselves and our loved ones. Obviously, a critical topic where we need the very best advice and information possible. On that note, I'm excited to introduce somebody that could handle that all for us, and I think could really give us some fantastic advice and counsel. Meet Stephanie Long from CarePatrol. CarePatrol provides senior care options based on the care needs and quality of our life and our loved ones. Stephanie, welcome to the podcast.
Thank you, Steve. It's always good to talk with you.
Absolutely. You know, this is such a critical topic that, like I said, it's going to affect ourselves and our loved ones. And this could be very intimidating. If you don't know how to navigate these waters, this is something that, like I said, it's intimidating. It could be very nerve-wracking, very expensive. And I think what you and CarePatrol offer is so important and so critical to virtually all of us. I felt it was just a fantastic subject for an episode for the podcast. And, you know, I want you to tell us all about yourself and CarePatrol and how you could help so many of us navigate these, like I said, pretty tough waters.
Sure. I'm honored to be here and share information. CarePatrol, I'm in CarePatrol of San Jose. So I am in the Santa Clara County area. But what we do nationwide is we help seniors find assisted living, memory care, in-home care when they need it. When they can no longer live completely independently, they can find a trusted, knowledgeable local resource in CarePatrol to help them navigate what is usually an unknown topic. Most people don't walk into a senior living community or a residential care home for the elderly just out of curiosity when they're independent. So oftentimes the first time they are confronted with the need to have some help to live and continue to thrive, it's a new topic for them. So I'm honored to help them, find the best options, the safest options that'll fit their care needs. And again, it's a local focus that we offer. So I really take pride in knowing the communities, the senior care options in the Santa Clara County and San Mateo County area.
And what you said hits home. I have, unfortunately, two family members that are in facilities. And, you know, once we saw their decline and our ability to not be able to take care of them in our home, that's when, again, a panic, we run out, we do some research, and we go to our local facilities, and we'll start working online and this, that. But it's like a panic. And, you know, we did actually find somebody before I knew of your franchise, and this was years back, where a friend of a friend had some experience in this industry, and we leaned on them. And had we not, we would just be God knows where. I mean, we just were, shooting in the dark. We had no idea what's going on, and they were able to do that. So why don't you tell us a little bit about how it works for the patient, how from like a cost perspective, does it cost them or what have you? Walk us through how potentially that would work for the patient or the customer or the client in this case.
Yeah. So we work with clients when they need to find safer options in their geographic area that fit their budget. What often happens is a senior gets to a point where they realize it's a lot to have to manage a home, manage grocery shopping, manage meal prep, and even just having challenges with the activities of daily living, as we call them. The activities of daily living are the things that we need to do every day, like get dressed or, comb our hair, brush our teeth, take a shower, get up
Hmm.
out of bed and walk across our home. And sometimes those activities of daily living can be a challenge as we get older. And sometimes it can be a situation where it kind of comes up on you slowly over time, where you realize that a safer option may be to have some assistance available always to be there for you. But other times it can come on kind of suddenly, where you have a senior that may have had a fall or a stroke or some kind of just sudden acute condition that happens, and they need to find care options quickly. So what we do is we'll meet with the family, the senior, wherever they are, in their home. Maybe it's in the hospital or at a skilled nursing facility, wherever they happen to be. We do a very detailed discovery process where, my goal is to really understand what are this particular senior's unique care needs, what are their preferences when it comes to hobbies or interests. What was their career profession? What was their life's work? Learn. I also like to, we need to learn a lot about their financial situation and their geographic preferences. Where are their family members? Where are their advocates? So that we can help them understand what are the best, safest options that fit all those parameters. And what we do is we'll present options to the family, and we will tour with the family. We will go with them to these different care homes to help them understand what's on offer there, help them ask questions, really help them navigate that whole decision process. And just for full transparency, so I do this because I have a heart for working with seniors. But it is a business. And just so you know, there is the way that the business, the way that I'm paid a referral fee by the communities with whom I work that are part of my network. And I only work with the safest, um, best maintained, most reliable, best reputation, highest care quality homes. So I'm paid a referral fee by them. It's that way we can keep this service completely free to families. There's no
Right.
cost to families whatsoever.
Right. So for your services, for your counsel, your advice, you're
Hmm.
doing the legwork, doing the research as to
Yeah.
placing people, in essence, in the most appropriate setting. There is no cost whatsoever to the patient for your services, correct?
Correct. Correct. And that's because
That's
we are,
great.
yeah.
I think that that takes a huge burden, or that's a big relief for the client in this case, where they don't have to worry about that, and they know that irrespective of that's not a factor in where you would look to place them.
Correct.
You just you want them to get the best possible care. And
Correct.
tell us a little bit about, as I was reading up on Care Patrol, your franchise, in essence, or you're part of a nationwide network. They've got a long, storied history. Tell us a little bit about Care Patrol, the support they have as a nationwide company with a stellar reputation in this field. Why don't you tell us a little bit about that?
Yeah. So Care Patrol, we just celebrated our 30th anniversary as a company. It was started by the Bon Giovannis 30 years ago, and they recognized that, Chuck Bon Giovanni as a social worker had recognized that oftentimes, clients he was working with could really benefit from being in a better care setting. So, what I love about working for Care Patrol and having a Care Patrol franchise is that I can have a fantastic, experienced, supportive community in Care Patrol and among the other Care Patrol franchisees. But I also have the ability to offer these services in a very localized, personalized manner in Santa Clara County. So I appreciate the 30 years of experience to help me always kind of hone my best practices, really help us have the best methodology for ensuring that we are researching and finding the safest care options. I've learned a lot from my fellow franchisees along the way. So I think there's a great benefit to having that network behind me, but also combining that with my just personal commitment and love of my local community where I
I,
grew up.
I think that's great. It sounds like it's in essence the best of both worlds. They get that local personalization from you, and you're based in Santa Clara County. Just to reiterate
Mhm.
for some of the folks that people will be joining this podcast periodically. You're out of Santa Clara County in California, but you have that support of the mothership, for lack of
Yeah.
a better word, behind you. And then here's a question I would have. So you being in the Bay Area, Santa Clara, Cary, let's say a family member or a friend had somebody in another part, let's say Southern California or Central California,
Yeah.
or even in a different state. Do you have the ability to do some? Can you refer them to a franchisee in their local jurisdiction or community, so you could give them that same type of service, but you have partners that you collaborate with that can help somebody in, let's say, out of state or another part of California?
Yeah, absolutely. And I've done that. I've had uh, friends, people in my network reach out to me who have loved ones in Texas, Oklahoma, uh, New England, different parts of the country. And what I love is that I do have counterparts across the country in different markets where they are the local resource, where they know the safest and best care options, where they know the also the regulations, right? So every state is different.
That's a great point.
Assisted living is regulated by states. It's not regulated by Medicare because it's not a assisted living is not a medical facility. These are care facilities. So they're regulated by the states. Every state has different ways of referring to care homes, has different ways of licensing them, and has different requirements. There's a lot of similarities, but certain states can do things a little bit differently. So the nice thing about having a network of senior care experts is they're experts in their local territory. So I know when I'm referring a client or a friend with a loved one elsewhere that they're going to be in really great hands.
That's a great point. There really is. So you have a big reach all across the country
Hmm.
versus just locally in the Bay Area. And like you said, that's a good point to reiterate, because I would have thought, or before I needed to do this for a family member, that this is a federal issue, one size fits all across 50 states. And clearly that's not the case at all. And what have you.
Yeah, so nursing homes are different from assisted living. I guess this is a topic we can educate people on a little bit because it is sometimes confusing. So hospitals and skilled nursing facilities are regulated by Medicare. So there's a federal aspect to it. But it's after that step, after you've been in the hospital and then maybe discharged to a skilled nursing facility or a nursing home for further rehabilitation, for physical therapy, occupational therapy. After that, what is the next step? For many seniors, it can be assisted living is the best choice, or it may be necessary because they need more help. But they don't need medical care. They need personal care. They need help with their activities of daily living. They need help getting
Hmm.
dressed. They need help showering. They need help with meal prep. So,
Right.
assisted living facilities, those are, again, they're care facilities, not medical, therefore regulated by the states. And here in Santa Clara County and in California as a whole, what I'm proud of is that the state of California does a pretty darn good job of doing regular inspections and providing those reports uh, to to the public. I know how to access those reports, find those reports, so I can do a really well researched recommendation for my clients. But yeah, it's an important distinction: care homes versus nursing homes.
Mhm. That's good to hear. I mean, I think that just builds confidence for your clients and your patients. Hearing all that, it's not just a casual process where
It's
they
not
throw a
just
name of
based
a
on Google
facility.
reviews or Yelp reviews.
Right, right.
Yeah, yeah.
We know, yeah, that's yeah.
Those can help, or those can be one factor. But I think it's really important for people to know that there are very, very detailed inspections,
Mm.
a very comprehensive set of regulations that these assisted living facilities have to follow, whether they're big or small, whether they're a big community with 120 apartments and a pool and a gym and a salon, or it's a very small residential care home with just 6 residents. They all have to follow these same regulations. They're all held to the same standards in California, and um, all of that data on the care homes performance to complying with these regulations is on record. So
Mm.
I use that as well as my clients' feedback and my personal knowledge and visits of these care homes, my own personal observations and notes and meetings with the care home owners.
And that brings me, that's, you just kind of stole my thunder, but in a good way.
Sorry.
So when people, no,
Yeah.
that's good. No,
Yeah.
this is all about you. I mean, you're the expert here. So people understand this. It's not just like a Zoom call or telephone call. Will you go when they're looking at options and different facilities?
Mhm.
Will you go meet with them face to face at their
Mhm.
home or at a coffee shop or a neutral site, or
Yeah.
take them or meet them at the facility? Walk us through a little bit how it works for you when you're working with a client or a patient as you're trying to identify and ultimately choose the right facility for them.
Yeah, it usually starts with a phone call, and I like to get a little bit of kind of some basic information about the current situation with the senior, and then oftentimes I'll meet in person with their with themselves, or if they can't meet in person, meet with their responsible party, whether it's their adult children or their spouse. And then at some point, hopefully, I get out there to meet the senior themselves if they're in the hospital or the skilled nursing facility or in their home, wherever they happen to be. But yes, I oftentimes after that first kind of initial phone call, initial discovery, I'll go meet in person with the family, with the senior if possible. And then I do go with the family to visit these care homes in person. And it's not the first time I've been to these homes. So a lot of the time, in the background, when I'm not working with a client, what I'm doing is I'm going out and visiting care homes, doing tours just for my own research and knowledge. So I can have a good understanding of what they offer. So one of the things to know with assisted living is they all have to follow the same set of regulations, but they don't all have to offer the same care. So what's important for me to know with each care home is, well, what are the policies of this care home? What are conditions that they're willing to accept? Which ones don't they accept? If they have a nurse on staff, that can allow them to offer other things, other care, but it doesn't require them to. So it's really important for me to do my homework when I'm not working with clients, out and about with clients. I'm always out and about, though. I spend a lot of time in my car driving around
Mhm.
to meet, new or revisit existing care home administrators and their communities.
Right, I would imagine, and that's good. So you're doing your homework, you're doing your research.
Yeah.
So as you probably have your clients may have a whole variety of conditions,
Yes,
and facility A might be better for John Doe, facility B might be better for Jane Doe, what have
absolutely.
you. And the beauty of you having all that homework done, if you will, beforehand or in parallel with them is, let's say you do your discovery call on a Wednesday, but Monday, Tuesday, you were researching appropriate facilities for this client. You have a basic idea of their conditions and this and that. And you say, hey, I think, this facility might be a good fit for this client I'm about to get on the phone with for first initial discovery. And that's working smart. That's working, thinking a couple steps ahead. And by the time you do that call, you can say, hey, Mrs. Smith, boy, I think we may have just the right facility for your needs. let's take a look at facility XYZ, talk about it. Then you go there, meet with the family and the care, their caregivers, and you've now just worked really efficient and smart. And before you know it, you might have a great match because of some of that homework you've done, some of that reconnaissance, if you will, and some of that work in a proactive way before you actually did the call with the client.
Yeah, and I think that is, thank you. That's you lay this up for me. I think that's an important point in that working efficient is key here, because most of the time my clients are coming to me from a skilled nursing facility. They've been discharged there after a hospital stay, where they maybe had a fall, a fracture, a stroke. So they're in skilled nursing. And there's only so much time that they can be in skilled nursing before they're discharged. And so we are often working with a compressed timeline. And it is
Mm-hmm.
really important that the senior living advisor like myself that you're working with, whoever you're working with, it's really important that they know the options and have relationships with these communities in your area, because you don't have the luxury of time. Your senior loved one may not be able to go home, but they can't stay in that skilled nursing facility forever, nor
Mm-hmm.
would you want to, right? There's going to be a
Right.
discharge date, and it's usually coming up faster than anyone expects. So having the ability to know your community, me knowing my community, knowing the care home
Mm-hmm.
administrators, does bring a lot of efficiency, and you want to get it right the first time. This is a scary time for seniors. The idea of like, okay, I've got to make a move away from a house that maybe I've lived in for 30, 40, 50 years is
Mm-hmm.
daunting. Imagine it for us, how it would feel to like have
I
to, yeah, it's scary. So you want to get the match right the first time. It is, you don't want to move people around. You want to get that match done the first time so they can settle in, they can adjust, they can get to know the caregivers, they can get to know maybe their other community neighbors in that community, and really have the best next chapter. So that's super important. And when it comes to one other thing I just want to mention, with seniors along this note, is every senior is different, and there is a huge variety in what care homes offer, huge variety in size, in care capabilities, um, budget. So yeah, being able to work efficiently through all of those different options is important so that we can get the right match.
I'm glad you brought that up. I was going to ask the facilities that you work with. They must cover a wide variety of conditions, whether it be physical, mental, and/or both. Palliative care. I mean, it can run the gamut, and that's important that you have that Rolodex, for lack of a better word, excuse me, of facilities that can cater to so many different medical conditions and needs. It's not a one size fits all. You don't just stick somebody in facility X. I mean, you want it to be, you're cater to their needs and their wants for their conditions. And I'm glad you brought that up, because a lot of people may think it's just okay, it's a generic facility and what have you. There need, something specialized for Alzheimer's or dementia
Yep.
or Parkinson's or something like that,
Yep.
or like a broken hip or a physical thing versus a mental. And I'm really glad that you mentioned that, because that was going to be one of my questions about, tell me the variety of different conditions that facilities can cater to.
Yeah. So assisted living, again, it's personal care. It's not medical care. But if that community happens to have a nurse on staff, they may be able to handle a diabetic condition where the senior needs insulin shots and they're no longer able to manage those shots themselves. So like that's one really good example of understanding what the specific needs of the senior what their specific needs are, because if they have diabetic if they're diabetic and they have the need for insulin injections, that takes us down a different route. That's a really important filter. Same thing if they're ambulatory or non-ambulatory, that takes us down a different route. It narrows the options. Or if there's a cognitive diagnosis, there are facilities that have the secure environment to help meet the needs of those with dementia or Alzheimer's and to keep them safe. So it's very important to understand what is needed so that you can put them in, recommend the right facility based on their needs.
No, I think it's important. Maybe it's a tough subject. I mean, it's not easy, let's face it, but
No,
it's
not
critical.
easy.
Right,
Yeah.
right. And God bless the work you're doing. I mean, I think this really is a calling. And yes, you're a business owner. There's no question about it, and you're a franchise owner. But I think this is a calling when people in healthcare, and it says to anybody I meet in healthcare, it is absolutely a calling. Do you want to help others along? In-
Yeah.
our health is number one. If we don't have our health, not a whole lot else matters, frankly.
Yeah.
And I think that's fantastic. As we wrap this up, any last words you want? And I'm going to have obviously banners with all your contact information and how they can reach you and the name
Yeah.
of your facility. Like I said, because people join the podcast at different stages, so I'll include all that, all the links and everything, so they can get in touch with you. But any last messages you want to get out to people as we wrap this up? And like I said, this is such an important topic for people.
I would just say I really appreciate what you said about how important it is to meet individuals' care needs and also dignity. I think that is one of the driving forces that guide my work. Is I have loved ones in my family who are incredibly dear to me, and they've worked so hard their entire lives, and they've given to their families. And I think what motivates me to do this work is because I want to honor and respect and show that honor and respect that I have for all the sacrifices that they've made through their lives. And I want to give them the very best kind of golden years. I want them to have all of the dignity and all of the best ability to thrive. So that's what guides me and why I do this. And I appreciate you giving me the time to share what I do, because it is an honor to help seniors. It is an honor to help families in what can be a stressful time. And I appreciate you giving me the chance to share.
I mean, I think that's important. And I don't know if I was going to mention this now, but I'm going to now. I actually met Stephanie. It has literally been about 24 years ago or 23 years ago. We met through another industry.
Yeah.
And I had a chance to interact with her 23 years ago. And I'm proud of the fact that we still have this working relationship 23 years later. I think that speaks to her integrity. And she really is such a nice person. She's sharp as could be. And just like I said, it speaks to her character. And now that she's putting all those traits together to help others, I think that's something pretty neat and special. And I knew I wanted to help her spread the word once I heard that she was in this industry and helping others in, like I said, in such a critical aspect of our lives. So I think that makes a difference. And according to some of the noise, we have Archie. Archie hasn't photobombed our set yet, but he might at any point in time.
I would love him to photobomb.
Right.
I love dogs.
Well, okay, hold on. On that note,
and if a senior has a dog, that's important to know too, because some places will take their pets. Anyway,
I was going to see how we just incorporate Archie into every possible piece of business.
Yeah.
No, it's important. And when I had my previous lab, Jack, the Black Labrador Retriever, I was fortunate enough to take him to the VA, to schools, to the hospitals.
Yes.
And it is unbelievable how they perk up when they see that dog. It changes. They went from maybe a very sad, depressed state to they see that dog and like, who doesn't love him? And I'm going to see if we can get Archie up here without me exposing the bald spot entirely here, folks. So Archie, come here, buddy.
Yeah.
Archie,
let me see.
Archie is a little too. There we go. Right. How about this for impromptu?
Hey, Archie.
We're going to try and get Archie in that program like his predecessor, Jack, but Archie's got a little bit too much energy right now. He's a 3-year-old chocolate lab, and he can be a sweetheart, but he could also be a little bit of a maniac at times.
He's enthusiastic.
That's right.
He's got a lot of love to give.
He does. Love is his middle name. But if you can, for a quick second, just talk about that. If the client has a dog,
Yeah.
or in some facilities, because I know where one of my family members, they're very welcoming of the dog. They bring the dog over to visit all the time, and it
Yes.
absolutely just makes their day to have their dog there. It lifts their spirits so much.
I agree. Yeah. Yeah,
Right
absolutely.
on?
So some communities are pet friendly. The
Mhm.
usual requirement is that the senior needs to be able to care for the dog because otherwise it'll fall on the caregivers, and the caregivers are really there to care for the humans. So
Mhm.
most, the requirement is as long as the senior can care for the pet. There
Mhm.
is, I see cats, I see dogs. A lot of the communities have the pet area, the dog area, pet relief area, the dog
Right.
park. I see dog walkers coming in and out of some of the bigger communities where residents can hire a dog walker if going for a walk. If the dog needs more walking, then that senior might be able to provide.
Mhm.
So yeah, a lot of them welcome. And if the smaller homes, boarding care homes, where they're more geared toward higher acuity care,
Mhm.
sometimes they'll bring in. I've seen them bring in like bunnies, or you can
Sure.
bring in a pet for a visit. Maybe it can't
Right.
stay there, but the spouse or the adult children can bring in the pets for a visit. So yeah, animals I think are wonderful for people's spirits, and there are ample opportunities for pets to do what they do best, which is to
Couldn't
love us
couldn't agree
unconditionally.
more.
Yeah.
Couldn't agree more. As long as Archie has treats, he's pretty self-sufficient.
Yeah.
He can right. He doesn't need a lot of care, but right, he responds quite well to treats. But we'll put him down for now, so he
Super
doesn't kill
cute.
me here. But yeah, no, Archie's he's a good dog. But no, I think that's great. And like I said, I really appreciate you getting this message out. I think this is one of the more important topics I'll ever have on the podcast, because this is going to affect all of us at some point in time in our lives. And I think having a subject matter expert and a confidant and a friend and someone so caring as you. Anybody that engages with Stephanie will love her. She's just fantastic, and I honestly, I am biased to her. She's
Thank
just a
you.
great gal, but also sharp as a tack. And I think this is exactly the kind of advocate you always are. You always hear that cliche: you must have an advocate or must be your own advocate. But when you can't be your own, you need someone like Stephanie to help you navigate these waters, because it can be intimidating and tricky. That's for sure. So thanks once again. I'm sure
Thank
we'll
you.
talk down the line if there's some updates or some new developments. We'd love to have you back again on a future episode. And once again, like I said, I'll get all your information out. Thank you so much for sharing all this info with us.
You, Steve, it was so fun to talk with you. I really appreciate it. It's always a pleasure to work with you and talk with you.
You bet. Take care, Steph.
Thanks. Bye.
That's going to do it for today's episode of Steve Means Business. Be sure to subscribe and share this podcast with all your friends. Keep a heads up for episodes every week.